think depending on your institution, obviously it's best to start local and then move out. Look for faculty that are involved in international or global health related projects or have a global health interest, and see if there's a way for you to be able to participate with them. I mean, like for ourselves, I mean, obviously we're here seeing patients full time, but we take time out of our schedules to participate in these different programs. I mean, I myself, I might be away for up to maybe 8 weeks internationally for things, but only maybe 4 of those are maybe global health related issues. I've certainly had trainees join me. I haven't had a medical student join me, but I haven't had a medical student ask me either. So I would say don't be shy about asking. And worse is they say sorry, but they might say yes. And then I think just letting people know that you have an interest in global health. There are opportunities. You can go actually to the American Academy of Ophthalmology website, and there is a interglobal global health or global ophthalmology, I think they call it, and there are lists of resources there. So some organizations will have medical students join them. It may not be ophthalmology. I think, as Edith alluded to, you don't have to necessarily do an ophthalmology global health experience to understand global health. I mean, it can be in any area, and you might not necessarily be doing surgery, but you might be, helping in the screening process or, some other health-related project, so you get a sense of what it's about. And obviously, the more you see, the more you tend to understand, and more opportunities come up when you kind of stay involved. But I think there are local resources as well as some national resources, and Unite for Sight, for example, is another organization that has connections as well, which students can get involved with. So there are opportunities out there. You do have to dig for them a little bit, but it really depends on your institution and who you meet.
Don't be afraid to ask. I remember when I was interviewing both for intern year programs and residency programs, I did specifically ask about any global health opportunities at those institutions, whether they were built into the curriculum or just in general, whether the program would be open-minded, or if there's some sort of elective time that I would be able to pursue something like that, because that was something that was important to me. And so if it's something that you feel passionately about, definitely ask. I don't think it will come to you, or at least the really meaningful opportunities won't come to you unless you go looking for them. And so I think, as you're looking for programs, if it's something that you feel strongly about, definitely ask about opportunities or elective time and what the options are for that. And ask if there's people at those programs that are involved in global health, because I think the second most important thing after asking and actively seeking out opportunities is to identify good mentors that are going to be able to help you get there and do the things that you want to do. Because when you're a trainee, you can have all the intentions and all the ideas, but you really need people that can help you make them happen. And if there are people at those institutions that are involved or just as passionate about you or about global health as you are, then I think that just makes all the difference in the world. So the intern year that I did had a month of elective time that I was able to do anything with, either in the US or outside of the US, and there weren't many options like that. And so that was a big factor that went into my decision of choosing that intern program. And so I was able to go to Peru for a whole month and do various ophthalmology related work there. And as I mentioned at Mass Eye and Ear, I've found great opportunities here. There's the Aravind rotation that's scheduled into the program. There's faculty members like Dr. Kempen that are abroad a majority of the time that are a great resource. And there's people like Dr. Freitag that are also traveling and very involved in global health. And that's been made a really big impact on kind of my training. So I think ask, seek it out, and find good mentors would be my biggest advice.